Stop. Before you worry about kidney stone surgery, take 5 minutes to learn about natural prevention methods that may support your kidney health. Kidney stones affect 1 in 10 adults and can cause severe discomfort. But here's something encouraging. The Mayo Clinic reports that 80% of stones smaller than 4 millimeters pass naturally on their own, with no surgery needed. Today, I'll share 5 science-backed methods that may support your body's natural ability to maintain kidney health. These include hydration strategies, dietary approaches, and herbal options. Each method is referenced from reputable sources like the Mayo Clinic, the National Institute of Diabetes and Digestive and Kidney Diseases, and peer-reviewed studies. But first, this is critically important. Everything in this video is for educational purposes only. These methods may support kidney health, but they are not medical treatments. They cannot cure, dissolve, or remove kidney stones. If you have kidney stones, or any kidney condition, you must work with your doctor. These methods should only be used as complementary approaches alongside professional medical care, never as replacements. Always consult your physician before starting any new health routine, especially if you're over 60 or have existing medical conditions. If you experience severe pain, fever, chills, blood in your urine, or difficulty urinating, seek emergency medical care immediately. Surgery may still be necessary for larger stones, infections, or complications. With that understanding, let's explore 5 natural approaches that research suggests may support kidney health. So what are these 5 methods, and what does the science actually say? Let's break down each approach step by step. Method 1. Proper hydration with lemon water. Water is fundamental to kidney health. When you drink adequate water, it dilutes your urine and may reduce the concentration of minerals that form stones. Lemon contains citrate, a compound that research suggests may help prevent crystal formation. Here's how to apply this method. Drink 2.5 to 3 liters of water daily. A simple way to monitor this is by checking your urine color. It should be clear or pale yellow, not dark. Throughout the day, add the juice from 1 to 2 fresh lemons to your water. Avoid bottled lemon juice with added sugar, as excess sugar may work against your goals. What does the research say? Clinical trials published in medical journals show that lemon juice may increase urinary citrate levels. One study found that participants who consumed lemon juice daily had a 50% reduction in stone recurrence compared to those who didn't. Another study noted that just 4 ounces of lemon juice daily was associated with beneficial changes in urine chemistry. A practical tip: monitor your urine color each day as a simple hydration check. For maximum benefit, pair this hydration approach with reduced salt intake, as high sodium may increase calcium in your urine. Remember, this method supports kidney health. It does not replace medical treatment. Consult your doctor before making significant changes to your fluid intake, especially if you have heart or kidney disease. Method 2. Apple cider vinegar. Apple cider vinegar contains acetic acid, which some research suggests may increase citrate levels in urine and support overall kidney function. Here's the proper way to use it. Mix 2 tablespoons of organic apple cider vinegar with 1 full glass of water. Drink this mixture once or twice daily, preferably after meals. This is important. Never drink apple cider vinegar straight or undiluted, as the acid can damage your tooth enamel and irritate your throat. What does the science suggest? A 2019 study published in a peer-reviewed journal found that daily vinegar consumption was associated with lower risk of calcium oxalate stone formation, with no significant side effects reported. The study noted that vinegar may boost urinary citrate by 20 to 30%. However, there are important considerations. If you have acid reflux, gastritis, or diabetes, consult your doctor before using apple cider vinegar, as it may interact with certain medications or worsen digestive issues. Some people may experience stomach discomfort, so start with a smaller amount and see how your body responds. Again, this is a supportive approach only. It does not treat or cure kidney stones. Always work with your healthcare provider. Method 3. The DASH diet approach. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is an eating pattern rich in fruits, vegetables, and low-fat dairy. Research suggests this dietary approach may reduce kidney stone risk by 40 to 45%. Here's how to follow this approach. Increase your intake of fruits like bananas and oranges, leafy green vegetables, and low-fat yogurt or milk. At the same time, decrease red meat, processed foods, sweets, and salt. Aim to keep your sodium intake under 2,300 milligrams daily. A sample day might look like this. For breakfast, low-fat yogurt with fresh fruit. For lunch, a vegetable salad with grilled fish. For dinner, whole grains like brown rice, with steamed vegetables, and a small portion of lean protein. What does the research show? Large-scale studies involving over 240,000 participants found that those following a DASH-style diet had significantly lower kidney stone risk. Researchers believe this is because the diet increases urine volume and citrate while lowering calcium excretion. A practical tip: start gradually. Don't try to change everything overnight. Begin by adding 1 extra serving of vegetables each day, then build from there. This dietary approach supports overall health. It does not treat existing kidney stones. Discuss any major dietary changes with your doctor or a registered dietitian. Method 4. Herbal teas, specifically green tea and hibiscus tea. Green tea and hibiscus tea act as natural diuretics, meaning they may increase urine flow. Some research suggests they may also support overall kidney function. Here's how to incorporate them. Drink 2 to 3 cups of green tea or hibiscus tea daily. Steep 1 tea bag in hot water for 5 to 10 minutes. Drink it unsweetened for maximum potential benefit. An important note: avoid black tea if you're concerned about kidney stones, as it's high in oxalate, a compound that may contribute to stone formation. What does the research suggest? A large study of over 500,000 Chinese adults found that daily tea consumption was associated with reduced kidney stone occurrence. Laboratory studies show that green tea polyphenols may reduce stone formation by 20 to 30% in controlled settings. However, remember that laboratory results don't always translate directly to human outcomes. These teas may support kidney health as part of an overall healthy lifestyle, but they are not treatments. As always, consult your doctor before adding herbal teas to your routine, especially if you take medications, as some herbs can interact with prescription drugs. Method 5. Chanca Piedra, an herbal supplement. Chanca Piedra is a South American herb. Its name literally translates to stonebreaker in Spanish. Some preliminary research suggests it may support kidney health, though more studies are needed. Here's how it's typically used. The common dosage in studies is 400 to 500 milligram capsules, taken 2 to 3 times daily with meals. You can find it in health food stores or online, usually labeled as Philanthus naruri, which is its scientific name. What does the research say? A 2018 pilot study involving 56 participants found that those taking Chanca Piedra showed beneficial changes in urine chemistry, including increased citrate levels and reduced calcium oxalate. Most participants in the study reported noticing changes within 1 to 2 weeks. However, this is critical. This herb is not approved by the FDA for treating kidney stones. The research is still preliminary and limited. You must consult your doctor before taking Chanca Piedra, especially if you take diuretics or blood pressure medications, as this herb may lower blood pressure. Do not take it if you're pregnant or nursing. This supplement may support kidney health, but it is not a proven treatment. It should only be used under medical supervision as a complementary approach. Now let's talk about realistic timelines and expectations. For stones smaller than 4 millimeters, research shows that 80% pass naturally within 1 to 4 weeks, often with increased hydration and dietary support. Stones between 4 and 6 millimeters may take up to 6 weeks and may require medical monitoring. How can you track your progress? Keep a simple health journal. Note your daily water intake, dietary changes, and any symptoms. Are you experiencing less discomfort? Is your urine clearer? These may be positive signs, but they should always be confirmed with your doctor through proper testing, such as ultrasound or CT scans. It's important to have realistic expectations. These natural methods may support your body's ability to maintain kidney health and may help with prevention, but they work slowly and gently. They are not quick fixes. Some people report positive experiences with these approaches, while others may not notice significant changes. Everyone's body is different. If your pain increases, or if you develop fever, chills, blood in your urine, or difficulty urinating, do not wait. Seek medical care immediately. These could be signs of complications that require urgent treatment. You now have 5 science-backed approaches that may support kidney health and natural stone prevention. Your action plan starting today. Step 1. Begin increasing your water intake this morning. Aim for that 2.5 to 3 liters we discussed, and monitor your urine color as a simple hydration check. Step 2. Write down these 5 methods in a notebook or your phone. Track which ones you want to try first and how your body responds over the coming weeks. Step 3. Subscribe to join our community of 48 members who are learning about kidney health, heart health, and joint health for adults over 50. We share practical, science-backed tips every week. Leave a comment below with day 1 so we can follow your journey and answer your questions. We typically respond within 24 hours. If you have specific questions about any of these 5 methods, drop them in the comments and I'll do my best to help. One final reminder. These methods are supportive tools only. They may help with prevention and overall kidney health, but they cannot replace professional medical care. Always consult your doctor first, especially if you're on medications or have existing health conditions. Your doctor may suggest imaging tests like ultrasound to monitor your kidney health over time. You're not alone. Thousands of people over 50 are right here with you, choosing evidence-based natural approaches as part of their overall health strategy. Hit that subscribe button, turn on notifications, and let's continue this conversation. Here's to supporting your kidney health naturally. Take care, and I'll see you in the next video.